Hi, can y'all hear me just fine? Hi, my name is Summer Faruqi. I am ADAPT Public Relations Specialist. Thank you all for coming to our Pathways to Prevention, Staying Ahead of Diabetes seminar. We're gonna get started here. With me, I have Dr. Terry Lundy, who was our former Chief Medical Officer. Now she's retired and on the board of directors. But she's also here with UC Veg and Thrive Umpqua. And here we have Marcy B, who's one of our providers at ADAPT. And we were scheduled to have Hannah from YMCA, but unfortunately, due to personal circumstances, she couldn't be here tonight, but we appreciate all the work that was put in for her portion for tonight's seminar. So thank you all so much for being here. I'm gonna get started with Dr. Lundy, who will take us off.
Okay. Okay.
That's fine.
All right. Hi. Good evening. Hopefully everybody's enjoying their soup. Reminder, there's plenty of handouts, and also that we're open to having questions and conversations during this seminar. It's not just a lecture and then you go home. We want you to see, ask questions if you don't quite understand it or want to clarify something. But I'm going to talk about why it's important to try to prevent diabetes and how to do it and some ways to do it, so you can get some ideas on how to do it. It's really important to prevent diabetes, and Marcy over there is going to talk a lot about the consequences of the disease and the disease itself. Most people know what diabetes is, but it has a lot more to it than some people realize. If we follow some of the guidelines we're going to go through and suggestions, you can not only help prevent diabetes, you can stop diabetes sometimes with these interventions. And it's real important for people to know that if you do these things to prevent diabetes, you can also prevent a lot of other illnesses too, including heart disease, high blood pressure and stroke, even some cancers. So it's pretty powerful. So it's very useful stuff for whatever you might not want to get. And some people think genetics is destiny, and it's absolutely not. If you say, well, all my relatives had diabetes, if it was type 2, we have some control over that, whether it's going to be a problem for us, and if so, how severe. That genetics play 20 to 30% of our health. 60 to 70% of our health comes from our lifestyle choices. And that's what we're going to spend some time on tonight. It's like, what can I do to maybe override the genetics? I heard an analogy about genetics, and some genes are dictators and some are like committees. And so some genetics are dictators, like if you're going to have blue eyes, you're going to have blue eyes. That runs in your family, and that's a hard dictator type gene, that it will always be that way. You can predict the probability. But other genes, including those for diabetes risk, dementia risk, heart disease risk, and some of those are committees, and they can be modified. You can make suggestions to them. They'll make suggestions to you saying, I'm going to put you in a diabetic place, but you can talk back with them and say, hey, let's take a look at that. And you don't necessarily have to develop diabetes. Now, I mean, strictly speaking, diabetes doesn't go away. You're still diabetic once you get that disease, but it can be to the place where, and Marcy will probably talk about that, where you're still diabetic, but all your numbers are good. Therefore, your risks are back to normal, or at least more normalized than they were before. So I'm going to talk about that. I'm going to focus mostly on nutrition, but a little bit on lifestyle. So how do we do this? What's a good way to do it? The consensus from most medical journals is that if you do more plants, then you'll be healthier. You don't have to go all plant-based, vegan, no eggs, no dairy, no meat ever. But if you lean toward what they call plant slant, and that's on the Thrive Umpqua positivity wheel, of one of the factors they go for to see, well, what gives people the healthiest lifestyle? And those who eat a preponderance of plants do better. They have lower weight and they have lower diseases. And so we call that plant slant. So that's fruits, vegetables, grains, nuts, legumes, beans, things like that. So it's not just eating salads all day. There's a lot you can eat, and be it plant-based or plant slant. And so that I'm going to go into some of that stuff too. And the other thing that plays a role in diabetes risk is a high fat diet. Now, some fats are good and better for you than other fats. Animal fats have no redeeming value, basically. They really don't. They are the things that help contribute to heart disease and blockage of all your arteries and things like that. And the fat also gloms up those receptors in your pancreas, so your insulin that's trying to do its job can't do it. And so the higher fat diet is not good for you either. So you can have some fats, and we don't expect anybody to be close to perfect or make huge changes, but maybe start considering some things. And there are some healthier fats that you can get from nuts, and maybe like avocados. And if you're having some fish or something, those are some healthier fats. I try to go all plant-based, but I'm far from perfect. So I don't eat much meat, but I kind of like my seafood once in a while, and things like that. So like I said, nobody has to be perfect, but just try to incorporate more plant foods in your diet. So how do we do that? We expect people not to change immediately, because if you do from it's always been this way, meat and potatoes, that's all I've ever eaten, and white bread, that's how I grew up, and then suddenly you're going to eat nothing but salads and vegetables all day, you're not going to stick with it. Nobody does. It's been shown time and time again. It works better to make gradual changes. So maybe eat no meat on 2 days a week. Eat something else in place of meat. And I'm going to talk about some substitutes for some of the things you're more used to. But just try to, and I also want to point out, it's not a change of depriving yourself. Hi, come on in and sit down. We have some soup. I want to focus on the fact that it's not a diet recommendation of taking things away. It's adding good stuff. Instead of saying, I can't eat that and I can't eat this. Should I pause? Okay, it's not a diet of deprivation, saying, oh man, I can never eat sugar, I can never eat meat, I can never eat anything good again, oh gosh. You know, and it's not that, it's adding some good stuff in. And when you start adding some of those good things, you develop a new palate. You kind of lose a little bit of the taste for those really rich, salty foods sometimes, and maybe some of those really rich, sugary foods. So over time, you do develop a palate, but just try gradually. And try some substitutes. Like, okay, I always have spaghetti with meatballs. Well, maybe have pasta, maybe a healthier pasta. You could still have the white pasta, but maybe there are some bean-based pastas and vegetable-based pastas that are a little bit more fiber for you, a little bit more protein in there, and then put a lot more vegetables on it. Like, I love pasta. You know, I can eat breads and pastas, but if I have a pasta meal, I have a lot less pasta and then a whole lot of veggies and beans. And it's pretty satisfying. You know, I just kind of got used to not so heavy on the pasta, a little bit more heavy on the vegetables and the beans and stuff. Add some flavoring somehow, the seasonings that you like, some kind of sauce that you like. Marinara is good because that's already vegetarian. So you can put vegetarian on there. Maybe add a bunch of chopped veggies in there. Add some more bell peppers or something, you know, mushrooms. Mushrooms are a good addition. Or if you're going to have a sandwich and you're used to having a meat sandwich and something like that, well, maybe have 1 slice of turkey instead of 4, and then add avocados and greens and onions and things like that. Use avocado or hummus instead of the mayonnaise on there. So you're getting some of the healthy goodness. Still pretty yummy. I like those kind of vegetarian sandwiches I've got, so I don't do the meat at all, and I don't really miss it. So there's some substitutions you can make. And people go, well, beans, I can't eat beans. I'll be tooting all day long. Well, you know, there's a lot of fiber in beans, and that's a good thing. But again, go gradually. If you're not used to any beans, have a couple tablespoons added to your foods. And over time, the goal is maybe half a cup of beans with a meal. And then you kind of get used to it over time, and so your body adjusts to that. And fiber is good for a lot of things, not just for keeping your system moving, but it also helps suck out your cholesterol, sucks out some of those toxins that are in some of your food, therefore reduces heart disease, diabetes, some cancers. You know, it's a pretty powerful thing, and it's filling. So if you're adding all these vegetables, you're adding something with a little fiber in it, you will be full. And you will end up with less calories. So kind of naturally, you lose some weight, and a lot of people need to lose some weight. Even if you don't need to lose weight, then you're just going to be very full. It's very satisfying. And so you can also add nuts, and nuts are very nutrient dense. They're also kind of calorie dense. So you can add nuts though, but use them sparingly because of the calorie load. But a nut butter, like for example, I eat a thin slice Rick's Killer Dave's good seed bread. And between 2 of those slices and 2 servings of peanut butter on there, I'm getting 25 grams of protein. And I'm getting, I don't remember how many, like 15 grams of fiber. And a fairly easy breakfast, for example. There are a lot of options for breakfast. I like toast. I like something like chewing to eat for breakfast. Other people like an oatmeal or multigrain cereal with fruit on it, maybe some plant-based yogurt, something like that. You get a lot of fiber, you're getting pretty filled up. It's pretty darn good. And so nuts come in the form of milks too. You can have almond milk, or, you know, if you have a non-nut, but like oat milk. So if you want to get away from the dairy, there are a lot of milk options, a lot of yogurt options, even some pretty good ice cream options that are plant and nut based. And then I just wanted to spend a minute talking about what's already back there with the Thrive Umpqua, the longevity principles. Like if you incorporate some of the stuff that Thrive Umpqua is doing back there, you not only can reduce your health risks, you'll feel better. I mean, I feel so good. I've been mostly plant-based for like, I don't know, about 8 years. And I'm not hungry. I lost weight naturally. I can keep weight off pretty naturally because I'm pretty full. And on the fullness part, I did want to mention one of the Blue Zone principles or Thrive Umpqua principles is to stop eating before you're full. You know, most of us don't do that. We eat till we're full and then, 10, 15 minutes later, we're feeling stuffed because it takes your brain 10, 20 minutes to register that you've had enough. And it's particularly important to stop before you're full if you're eating with other people, because studies have shown the more people in a social party, the more calories people consume because they're maybe not paying attention to what they're eating. And restaurant meals, of course, are way too big. And so I take them and put some away before I start eating, so I'm just not too tempted to do that. And then when I have my leftovers, some maybe less than perfectly healthy food, by the way, I'll just go home and I'll add steamed broccoli and peppers and mushrooms and stuff to it to make it a little bit more healthy on the part I took home. But people eat too much because they're not quite paying attention, or maybe not eating slow enough. But on the longevity, there's a lot of other things. We want to feel good. We don't want to just, maybe not just prevent diseases, but I want to feel good. So part of that is having connections, having friends, doing volunteer work, being involved, having a spiritual community, some sort of faith that you believe in, maybe a sense of purpose in your life. You know, all these things put together really make for a robust life that you want to live longer for. I don't want to live to 100 if I'm decrepit and feeling awful. But if I don't have to get diabetes, maybe don't have to have the kidney problems that come with that, maybe the blindness or neuropathy that comes with diabetes, I could feel a lot better. And the other thing about that, one of the principles is being a little bit more active. Now, you don't have to go run a marathon or walk 5 miles. The healthiest cultures, they just incorporate movement into their day. They walk to the store and pick up a couple things and come home every day. They, you know, run errands on foot, or even something here in America, you can just park at the far end of a parking lot and get like 100 extra steps every time. Get up during commercials if you're watching TV, some of this stuff, just get used to it. And walking is free, and most people, not everybody, but most people can do some walking. That's the easiest thing. And I'm going to wrap it up pretty soon, so Marcy gets a chance to talk as well. But even little things like, I learned this is like, even if you walk for 2 minutes after a meal, it helps your metabolism and your blood sugar control. So even if you're already diabetic or you're trying not to become diabetic and have those sugar spikes and everything, 2 minutes after dinner, and it's colder than, you know what, out there these days. I just have a route in my house and I walk around for 2 minutes and maybe do a mantra in my head or listen to something. And I go usually more than 2 minutes, but it doesn't take much to improve your health. You don't have to do 10,000 steps a day that you read about in the articles. That has been sort of, become a bit of a myth. But, a few miles a day is probably doable over the course of the day. Walk 10 minutes here, 5 minutes there, 2 minutes here, and over the course of the day, if you have an activity tracker, you find you did quite a bit. And all those things do help. I think that's about all I wanted to cover right now. Oh, I do want to add, drink a lot more water. If you're going to eat a lot of fiber and you're dehydrated, you're going to turn into a lump of fiber in that gut. You don't want that. You want to keep things moving through. And also, lots of times we think we're hungry and we may be just a little thirsty because we're not in the habit of drinking enough water. Okay, I don't know how long I'm going to talk, but I'm going to give the mic over to Marcy for a while. Oh, and Bentley, do you have a question?
What's the difference between type 1 and type 2 diabetes?
Marcy, were you going to cover that?
I
I
am
want me to
gonna
answer
cover
that. She's going to talk about type 1 and type 2. Yeah, so I'll let Marcy talk about the type 1 and type 2 diabetes, and you're talking about where do I get my food? Well, I get it from 2 main places. I go to the farmer's market most every Saturday, unless I'm out of town. Great fresh produce around here. We were just talking about that beforehand. We live in like the best place because it's such a mild climate that so many things grow here. Like you can get produce year round. Right now, it's like the squash and the potatoes and the beets and things like carrots. A lot of good produce, even in the winter, onions. Some of the lettuces, like you can get stuff even in the winter, and in the summer, oh my gosh, you get everything. And if you want to save it, you can freeze some of it so you can eat it later. And I did want to mention eating on a budget real quick too. Like you can use frozen vegetables. You don't have to have all fresh produce. But I get my stuff. I mostly go to Fred Meyer just because it's convenient. I've always done it. But Sherm's, a lot of people shop at Sherm's because they will add stuff that you want, saying, hey, I don't see tempeh or I don't see whatever. They'll order it for you, but they have a great health section and really good produce. So they have the biggest selection probably of the really healthy foods. And I will stop here in a minute, Marcy, but I wanted to talk about eating on a budget too a little bit. Like you can do the frozen vegetables. They're just as healthy as fresh and they're more convenient. And it's not expensive to eat healthy. Because if you're not buying junk food and processed food and meat, and maybe not soda, because that's not really recommended for good health, you can throw all that budget away and put it in your produce budget, and you're going to do all right. And a lot of beans are super cheap. Pastas, rices, brown rice, black rice, white rice, all the grains are cheap. Anyway, I will stop talking for now.
Thank you, Dr. Lundy. We really appreciate you. To Dr. Lundy's point, we have a paper here, meal plan on a budget guide. So I highly recommend that handout as well. But over to you, Marcy. Thank you.
Well, I certainly didn't have any problem with you
Going on and on.
talking. I'm fine. So I'll just kind of cut to a little bit more about diabetes. Kind of the bad news first, all types of diabetes. So in general is the 8th leading cause of death in the US. It's probably underestimated that because we don't always go all the way back to the diabetes started this, which started this. And 38 million people in the US are diabetic, one type or the other, but 90 to 95% of that is type 2. Diabetes in general is a condition of having too much glucose in the bloodstream, so blood sugar. And our bodies need glucose to function. We get it when our food breaks down to it. Some of it is used, some of it is stored in our fat cells, and some of it is stored in our liver, which we break down for when we need to. In that process, insulin is a key. It's a hormone that kind of works as a key to open the cells and allow the glucose to get into the cell so that it can utilize that for its functions. In type 1 diabetes, it's an autoimmune disorder that the body mistakenly thinks that the beta cells that produce the insulin in the pancreas are invaders, and it attacks them. And then they stop producing that. So if you liken insulin to a key, it stops producing keys, those keys that you need to open the cells. So in a person with type 1 diabetes, they have to have what we call exogenous or outside insulin to facilitate that process, or, they would eventually suffer from, all the things that go along with diabetes, and they would die from it. And in a quick way with no insulin at all. But the more common type of diabetes, to type 2, which I said 90 to 95% of the 38 million have, the beta cells are still generally making the insulin. But if you're likening it again to keys, there's either not enough keys, or there's some resistance, which is like you have rusty keys that won't open those locks. Or sometimes it's a little bit of both. But in any case, what happens is you still have that same extra glucose running around in the blood system, which is the problem. So some of the symptoms of diabetes in general, type 2 diabetes, include excessive thirst and excessive urination, because the body is trying to rid itself of that excess glucose. Fatigue, because the cells aren't getting fed, basically. And if it goes on long enough, blurred vision can happen, and even unintended weight loss, because it's like the person is starving. They're not getting the food into the cells, even though they may be eating. And then they may even get the neuropathy that you can have after years of having it, which is the pins and needles kind of feeling in your fingers and toes. So unfortunately, if somebody does have diabetes and it's not well treated, they can have a lot of health issues, and that's caused by, that excess glucose. So it can lead to cardiovascular disease, heart attacks, stroke, heart failure, blindness, kidney disease. It can even lead to amputations as a part of that, the end stream of that cardiovascular system. So even though it's an endocrine disorder, you really can think of it more like a cardiovascular disease, because that's where the target is. So it's, really important to kind of know that. And it can be determined by blood tests. And sometimes it's found incidentally. If you have a chem panel and you were fasting for another reason, and suddenly they notice that your fasting glucose is high, then you might have a provider that draws what's called an A1C. And that's just a test that has followed a blood cell over 2 to 3 month time period. And, it determines the saturation of glucose on that cell and gives a percentage that allows us to understand how much, how high that person's sugars have been running chronically. And in that test, anything 6.5 or higher percentage is considered diabetes. So that's all the bad part about diabetes, but let's talk about prevention a bit. Around 98 million people in the United States, it's estimated, have prediabetes. 8 out of 10 probably don't even know it. So this is a condition where the blood sugar is already running chronically high, but not high enough to, test for, positive for diabetes. But it's a good point to know, because I want everyone to do this all the time, regardless of their sugar levels. But it doesn't happen that way. Sometimes people need a little aha moment before they go, oh, I need to fix this. So if that's what it takes, then so be it. So it's really good to know, if you are pre-diabetic. But the lifestyle modifications are good for everyone. So the risks for type 2 diabetes do include some factors that we have no control over, but not very many of them. And one of them is advanced age. So anyone, and I don't think 45 is advanced, but anyway, over 45 is considered at higher risk. Then there's certain ethnicities such as Black, Native American, Asians, Hispanic, Latino, Pacific Islanders. They may have a higher risk. And then having a first-degree family member, father, mother, sister, brother, might play into the risk. But the good news is that there are a lot of modifiable factors, and we have control over these. So they include things like being overweight or obese, especially if it's in the abdominal area, being less active or sedentary, smoking cigarettes, excessive alcohol consumption, high cholesterol, and high blood pressure. So these are all things we can work on, and we do have control. And I want to point out that I was thinking about increased age being a risk factor, then pretty much everybody needs to worry about it, whether you have a first-degree family member or not, whether you have any of those other things or not. So knowing that those same lifestyle modifications can improve other things in your health, just like Dr. Lundy was pointing out, why wouldn't you want to try it?
Yeah.
They're focused on a few small changes, and we really recommend, doing, like she was saying, you don't want to just overnight change everything up, because what happens there, you go just so gung-ho, honeymoon period, and then boom, you drop it. And that's just human nature. I mean, the people with the very best intentions, great discipline and everything, life happens and they start moving farther away from it. Then they start feeling like, oh, I didn't do it completely right, so I just might as well just go back to what I was doing. So that's what I really caution you not to do. I'd really love for you to start looking at your current state. So whenever I talk to somebody that is dealing with, pre-diabetes or diabetes as well, I ask them, go walk through your day with me. Tell me what you eat. Tell me what you do. And we go through all of this. And then we start to say, they'll say, well, I drink a 2-liter bottle of soda every day and I just really love it. And I go, okay, so what if you drank half of that? Do you think you could get away with drinking half of that for a bit? Maybe we'll work our way down. And they think I'm going to say, oh, well, you can't have that. And you can't have this. And they go, oh, yeah, I think I could do that. Then they come back into me and you know what they tell me? I'm drinking a fourth of it, because they took the half and went further because they knew they had some room to wiggle. And that's what I want to give you, is wiggle room, because we're humans. And so every day you get up and you go, this is what I want to try to do. And if you don't meet it, you go, nuts, I didn't do it today, but I'll do it tomorrow. And then tomorrow, maybe you cut back a little bit somewhere else. Or you say, I really, really want to have that one treat that I love. Well, you go out and do a little more exercise, which I'm going to come up to here in a minute. Or you say, where can I cut back that I'm not cutting back from good food?
Yeah.
And you say, well, I'm normally going to have 2 pieces of bread for that sandwich. Why don't I take the 1 piece and put the stuff in the middle and fold it over? So there you've saved a little bit, maybe for some little small treat. And then you just have less of it. So ensuring regular, moderate physical activity is really an important part to this plan. If you're not doing anything at all, then actually that's pretty easy, because all you got to do is start something. Even if it's 10 minutes a day, even if you tell yourself, I'm going to promise myself 10 minutes every day, I'm going to do this, I'm going to walk, or I'm going to do something that will bring your heart rate up high enough that it would be difficult to talk and impossible to sing. So while you're doing,
I can't sing anyway.
but it shouldn't be to where you're completely out of breath, but to where maybe you have to do it like that if you were talking to someone while you were doing it. Okay, that is considered moderate physical activity. So you say, I'm going to do 10 minutes of that. And you start out and you do that 10 minutes and you're really going and you go, I can go a little farther. So you do. Then the next day you go, oh, got that 10 minutes to do and I'm so backed up today. I've got so much doing, so stressed out. Okay, I'll start it. And you do your 10 minutes and you go, okay, that's it, I'm done. Fine, but you did the 10 minutes. And then the next day, maybe you'll do 20 or 40, but you'll get that in. And it can be walking or running or singing or dancing, not singing. It can be hiking, biking, boxing. It can be heavy gardening. It can be chores. You know, if you're really pushing it.
That can live.
It can be playing a sport that you like to play. It should be something you like doing. Don't do something you hate to do. If you are not a gym rat, don't go to the gym. You'll hate it. I'm a gym rat, love it, but that's me. If you don't like it, don't do that. If you do like it, your insurance may cover it, so check that out. So they're covering some places like the Y. I know I've seen it, some Fitness First,
so.
Downtown Fitness, and even Planet Fitness. So if you do like, you know, the gym, and the Y has some amazing things. I can only speak to that because that's where I go,
Sitting here.
but they have all kinds of different programs. And you know, if you do like that, then look into that. But it can be something as simple as, you know, doing chair exercises in your house, or doing, you know, a walking the dog, if you have a dog. Cats are a little hard to walk, I hear,
Yeah.
but you want it to be something that you stick with. So that's why it's really important to think about, what do I like to do and what won't I keep up doing? But that's pretty much all I had. Did I answer your question about type 1 and type 2? Okay. So does anybody have any questions I'll pass it back to you, Sam. For either of us?
I was gonna ask you about type 1.
Okay,
Okay, more questions about type 1?
How do
Okay,
you get type 1?
It-
Why?
it can happen from a viral response,
Okay.
they think sometimes. It's basically an autoimmune, and the main thing to know is there's no prevention for it that we know of at this
Right.
point.
I asked that because our grandson got it, and they said at first they said because somebody passed on in the family. Well, nobody on any side has had it. And so then the doctor said, a virus attacked his pancreas. That's what they're excusing. Now you understand this was over 40 years ago.
Oh,
Yeah, so things could have changed. But
they
we-
haven't, I don't feel that they've learned that much
they
more about
really
it
don't
since
have a
then.
great answer for
Yeah.
what causes type 1. We feel like it's a little bit more genetic than the type 2. Type 2 is much more based on lifestyle and overweight. But type 1 could be an anomaly, just sort of a fluke, could be genetic, could be a viral. Generally, it's the type you would see in children, and it's
Yeah.
generally more severe and fluctuating in intensity,
Yeah,
and can have more consequences, generally speaking, but not always. People can become type 1 in their adulthood.
Mhm.
It's just less common.
If they're not responding to the normal medications, then we look to see whether or not they might be type 1.
Right, we didn't know maybe as much then. We're always learning more things about
I'm
things.
wondering if maybe something had changed in all those years.
No, we don't have all the answers yet.
Only that we're more aware of the latent onset of older people having that type than we were before.
Right, I was taught back in med school that all type 1 was juvenile or in children.
Right,
And all type 2 was in middle-aged overweight.
overweight,
Yeah.
yeah.
And I've known both types in the opposite type phenotype or body type. So it's not there's not 100% rule about this. There's generalities that are true.
But it's much more common to have type 2 than type 1. Like I said, it's 90 to 95% of all cases.
And the incidence and prevalence of type 2 diabetes has soared over the last couple of decades. If you look at statistics, the weight of the average, especially American on the Western typical diet, the weight has drifted up over the decades. and the diabetes rate has gone up concomitantly. It kind of matches the slope of increase. So weight is related to diabetes type 2 risk for sure.
As foods as far as I can see.
Yeah, and that's something we can still do something about. It's not easy. If it was easy to lose weight and keep it off, everybody would probably do it, or the majority of people would do it and keep thin, but it's hard to do. It's a lifetime of making moderate changes all the time. And fighting against your urges to eat those Doritos or a milkshake or whatever your weakness might be, you know?
I do tend to. I do tend to say no forbidden foods, because those are the
Right.
ones that you're gonna wanna eat
Right.
most,
Yeah.
and you're gonna get so focused on it, and then when you finally have it, you feel badly about it, so then you might not do the get back on the horse thing, because you feel bad and you just, sink into it. So I say, if there's something you're just dying to have, think about, is there anything good in it? Can I have a small amount of it? Maybe I'll just have it once and not have it again for this amount of time. So that way, this is nothing that you can't, like you were saying, it shouldn't be something that you feel, oh, are you doing this? It should be something that is easy enough to do that you can do it for the rest of your life, because that's really the only way that it's going to help all the things that it helps.
I think it also helps if the people in your household are on board with what you're trying to do. It's pretty challenging to make lifestyle changes, especially when it comes to food. When the other people in the house want to eat the other stuff. I mean, if that's what you used to eat and you kind of used to like it, it's pretty easy to backslide. So it helps if the other person is at least polite about what you're trying to do and not countermanding you, because like sometimes the spouse will say, I'm gonna eat meat all day, and that's all I'm ever gonna eat. But you make them something that has something that's not meaty and you don't tell them, and they go, oh, that was really good. What was it? I go, well, that was mushroom or something that had no meat in it. And they go, oh, well, fine. You can trick people into liking this healthy stuff sometimes. But it does help if the whole family learns this and kind of is on board with it.
If you do have somebody who's willing, even, I just go ahead and tell them. And I go, but please have an open mind and see what you think. And a lot of times, because you didn't sneak it in, I mean, it depends on.
Well, right, I'm just saying.
But because you didn't sneak it in on them, they're like, okay. And then then they'll be more honest about liking it. And then you just have to remind them that they liked it and make it for them. There's some great things that are, that you can, pull in and out of the rotation and make changes that everybody starts going, oh, let's have that again,
Yeah.
Any other questions?
Can someone talk about the A1C test? It looks
Sure.
at your blood for 2 or 3 months or something. How does that work?
So what it does is,
Repeat the question.
I'm sorry. So you're asking about the A1C test and how, how it figures out the blood. So it basically is looking at the life of a blood cell for about 2 to 3 months. And it's looking at the saturation of glucose on that cell. And it is expressed in a percentage that tells us basically, with somebody with 6.5, that their, fasting blood sugar is running around 125 to 145. And so each increment, each, tenth of a point, represents that basic range. And so what's great about it is you don't have to be fasting to take the test, because it won't make any difference. It's looking over that period of time, because we used to just go by fasting glucose, and we had to, was the patient really fasting? Or, if sometimes people would, want to fool the test so they wouldn't eat. Well, if you don't eat long enough, your liver says, oh no, I'm starving, and kicks out sugar, and they get these really elevated sugars. So this is just a lot better way to look at it. And does that answer your question?
Yeah, I'm just thinking I'm doing it, like, you don't want people to do a drastic change, but my A1C was 6.3 in December. So my next blood test is in April, so I'm challenging myself for 3 months. to bring that number down with the whole food plant-based diet.
That's great, and
And I'm hoping
probably
that
will.
for 3 months, I'm gonna see a difference.
And I think that you very well could, but are you also adding activity?
Yeah.
Okay, so, what I think that you will, but if for some reason it doesn't work out that way, have faith in the process and keep doing it,
Yeah.
because sometimes it takes a bit.
Maybe
I mean, fantastic. That's awesome. You see what I mean? You took that information, you ran with it. That's
Yeah.
awesome. So,
Yeah, I also wanted to add about that is like she said, it does take time because it's a lifetime of making some mild changes that you can live with. But also, the thing is, this is not 100% fix for everybody. Like you could do all these things we're talking about, and you might still have a high blood sugar, you might still have to take medications. You know, I've been doing this pretty healthy lifestyle for quite a long time. I'm very active. I eat really healthy, mostly plant-based. And I still have high blood pressure and high cholesterol, and there's nothing else I can do about it other than taking medications for it. Am I gonna quit doing the healthy things? No, I am not gonna quit them because they're just so good for everything. They're good for my cancer risk. I feel better. I can keep my weight under control. And so it does a lot of other good things. And so I urge people not to give up, even if you make these changes and all the numbers don't line up exactly where you wish. You're still better off for your total health.
and generally, if somebody does become diabetic after doing all those things, they can be controlled with, diet and exercise and maybe a little bit of medication if they need it. But they have a much better outcome than somebody who never took care of that or tried. So,
If there are none in the room, we did have a couple that came into the chat. We do actually have a fair number of people that came onto the live stream. So one of them was actually what Dr. Lundy was talking about previously with costs. But since you did answer like how to mitigate costs, what are some of the resources available in the community to support folks that may need assistance?
Well, I volunteer with UC Veg and they're giving a class, I think it's next week on low cost budget, healthy eating on a low budget. That's going to be offered up at the Fish Food Bank for those participants. But we do stuff like that all the time through UC Veg. If you go to their website, ucveg.org, ucveg.org, there's a lot of information in there. Recipes, all kinds of ideas and things like that. But I also do have a handout back there on a meal plan. I don't know where they got some of these prices. They're saying a loaf of bread is $1.39. My bread, my Killer Dave bread, is like $6 a loaf, but whatever. In general, this stuff is pretty cost effective. I think one of the samples on the eating healthy on a budget, one of my friends is preparing rice and lentils with some vegetables in it. Now, beans are dirt cheap. Even canned ones, you just rinse off the salt if you buy canned veggies and beans. But otherwise, the dried stuff is like dirt cheap. And rice is dirt cheap. Like you can buy it in bulk. And it's pennies. I mean, it's really inexpensive. And frozen vegetables can be purchased pretty cheap too. So you don't have to spend a fortune. It's nice to get some fresh produce at the store, but shop in season for the most part. Buy in bulk where you can. It doesn't have to be overly expensive. Buy stuff when it's on sale. Like I said before, if you're not eating meat and you're not buying soda, maybe not too much alcohol compared to before, you can save money there. Kind of like she was talking about her food budget. Have your treats. It's kind of like a bank balance. It's like, okay, I spent a lot of money on that dessert I love. And so I'm going to cut back over there a little bit on my other, calorie allotment or exercise allotment. It's a bit of a math equation in a sense, but it's not that expensive. So we do have a bunch of handouts back there, and we have people from Thrive back there and UC Veg who can give you some more information and get on an email list if you would like to get even more information.
Do we have other questions, Gray?
Yeah, the other one was, are there any programs that I could join to learn more and be better or do better? Which I might suggest if you're interested in speaking on the one that you lead.
That's where adaptations.
Yeah. So currently, there's something at Adapt that we're only able to offer to the patients at the moment. That may change, but at the moment, that's what we're doing, and it's a diabetes prevention program. It's a year-long course that meets once weekly for 16 weeks and then twice a month after that. And it's CDC curriculum, and it is shown to reduce the progression to diabetes in like 56%. In the study subjects that they followed. And right now, we're in the end of one and 2/3 away in another of the classes. So those aren't classes that somebody could join, but we're planning on starting one in March. So they can look at the website for that information. But it's something that, you know, even if somebody couldn't make every class, that's fine. We can work with you.
I also wanted to invite Jeff and Kaylee, if y'all want to speak a little bit more about the programs y'all are offering at Thrive on Fun UC Veg. So I'll hand it to Dr. Lundy for now.
Well, I've volunteered with both of those organizations and have for quite a long time, so I know quite a bit too, but if Kayla or Jeff wants to come up, that's wonderful as well, because they actually work there. UC Veg has a host of programs. We're just finished week 3 yesterday of a 13-week course on nutrition and lifestyle improvement, which some people in the room have participated in. It's nice because it's participatory, it's interactive, and it's supportive. And all these lifestyle changes do take some help. People just don't read a book about it and make big changes. But there's not only the class, which can be taken for free. You can donate if you'd like, which we'd like, but you don't have to. It can come as a free thing. And a lot of information at those classes with handouts and food samples. So you can try some things to eat. But they have the shopping tours where you can go to Sherm's and learn how to buy the healthy stuff. Like, where is it and what the heck do I do with it? And then we have cooking classes, not this one coming up as at the food bank, but we do them also in here. And every couple of months, we have a cooking class on different things. So you can try those samples as well. There's literature in there, there are handouts, there's videos, everything on the website that you can continue to learn. There's a lot of activities. Every 2 or 3 months, we have a potluck. You go, what can I eat? I don't want to eat beans or salads for the rest of my life. You'll come to a potluck and there'll be 75 items you can choose from, all plant-based, and you go, oh my gosh, I didn't know you could do that with squash or mushrooms or whatever. Oh my God, they make these amazing things, plant-based lasagnas, roasted vegetables, delicious, and quite a variety of foods. So the potlucks are free. You know, if you don't know how to make anything, bring a bowl of fruit. You can bring a bowl of nuts. We don't care. It just has to be plant-based. You don't have to know how to make anything when you come in. So that organization, so talk with them afterwards if you'd like to and get on their email list, both of them. They have a lot of classes. Thrive also does a lot of things with socializing, connection, and physical well-being. A lot of good things, amazing good things. That's all part of good health too.
Any more questions, Greg?
That was all.
Oh, we
Oh,
have
we
one
have
in.
Okay.
My husband just crossed the line from pre-diabetic to diabetic, and the doctor gave us 90 days to pooch back over across that line. And her focus was on carbs. And she said, we should be limited to 100 grams of carbs a day. If I'm picking up something that's already prepared and it's more than 20 carbs, I can't have it. And I'm just wondering if there are other guidelines other than just carbs, because I'm driving him crazy with the word carbs.
So the question is, to reverse diabetes essentially back to the pre-diabetes line, or even
That's our plan.
let's get rid of it. And the question is on carbs and how they can control that.
That's the way I learned it. I had very little nutrition training in medical school, that's for darn sure. And then most of the time when I was seeing patients, that would be what we'd say because I didn't know any different. Actually, I eat a lot of carbs, but they're complex carbs. I take away the simple sugars. I don't eat white sugar and white bread and white pasta. I have the complex carbs. You can have sweet potatoes, regular russet baked potatoes. Pastas, you know, I prefer the healthier pastas, whole grain, bean-based pasta, some of those healthier pastas that actually have quite a bit of fiber and protein in them. You'll get some carbs, but carbs are not the enemy. I would say probably 80% of my calories are carbs, complex carbs, mixed with some proteins and minimal fats. You know, and protein is not the problem. There's not a protein deficient person in America. So no, seriously, you will get enough protein in the mix of, if you eat a variety of foods. And this high fiber food with fruits and vegetables and grains, you will fill up and you won't even have to count carbs. But that's the old teaching. That's the way I taught to my patients in the past.
So I'm actually board certified in advanced diabetic management, so I had to go through classes and take a board and everything. And our movement is away from the counting the carbs. It's not that you don't want to know what, you kind of want to know all the nutrition in your meals, but you want to, you know, like Dr. Lundy said, you want to really focus on complex carbohydrates. And one of the things that I teach in the diabetic prevention program is I say, if you don't get anything else from me, more fiber, more fiber, more fiber. Obviously, not all at one time, because then you'll be really angry at me. But a little at a time. But look at the meals and look at what nutritionally do I have here? Do I have a lot of all my vitamins and, you know, and do I have plenty of fiber here and foods that are going to keep me feeling full? And, you know, yes, vegetables are going to have a lot of carbohydrates. You don't want to cut those out. So, yes, you know, it's kind of a balance between that. If you don't see improvement doing that, eating more complex carbohydrates and limiting portions and really watching, you know, calorie counts and, you know, that sort of thing, then might go back and look at the carbs. But by and large, carbs are not our enemy.
And when you talk about fiber, is there a magic number that we should have at least this much fiber with every meal in each portion or whatever you're cooking with?
There's not a magic number per se. I know they
40
say
is what
40, but I would, you know, if you're not eating 40 immediately, you're not going to want to immediately start at 40. But what I always tell people when they ask me about bread or something like that, I go, if it doesn't have 6 grams of fiber in it, I'm not touching it. So just kind of looking at, and also look at any sugar, even if it's natural sugar content versus, you know, the fiber content. And most of the things that you want to kind of stick with are foods that are not going to be in packages anyway. So you're going to want to try to keep as much whole food, you know, as close to its natural state as possible. Those are the things that are going to be healthier for you.
Okay.
Does that help?
It does.
Okay.
And I was looking for a while.
Well, that's, I
She's
have
gonna
a
move it to
diabetic.
Marcy.
I have a diabetic I take care of. My husband's been diabetic for 25 years, and that's one of the reasons I got involved in this. And I'm pre-diabetic. I'm not right at the moment, but I have been 6.3 before. So, you know, that's where you are. I get that. I did want to mention, up here we have cdc.gov and, you know, all of that. That's a website that you can do a pre-diabetes tool that I meant to bring and I didn't, and I apologize. But you can do it on your phone, or you can actually print it out and do it on paper. And it can tell you whether or not you're pre-diabetic if you don't already know. Okay?
Without a blood test?
Yeah,
It's your risk.
It's your
assessment
risk.
Not your actual like number.
Okay.
And then you follow it up with a blood test to see if you truly are.
Is there any advantage to these TV ads that have the capsules for vitamin or for fruits and veggies? Is there anything to that?
It's better to get natural vitamins.
state.
If you eat fruits and vegetables, array of color, an array of things, you will get enough vitamins and they're much better for you because you get the fiber in there.
Right.
And you don't have the preservatives or whatever the capsules are made in with.
That's right, how do you know? Supposedly they list ingredients and all this stuff, but you don't know what else is in there, like your capsule.
And they're not regulated.
That's right.
So I will tell you, I saw a whole expose in, back in nurse practitioner school years ago. And they were making these supplement capsules in a garage.
Oh, God.
And they made them with nothing that would hurt anybody, but nothing that would help anyone, just as a point to, as a study. And they went around and sold them to health food stores and to people, and then grabbed them away and said, you can't take those. They got sawdust in them, you don't want to take them. Yeah,
And the TV programs that promote it.
I would just stick to the natural food source.
Most people need a little vitamin D supplement, especially
Yeah,
living in
that's
this
the one.
climate and latitude. We don't get enough sun. And it's hard to get enough vitamin D in your diet, so
That's
that's
true.
one supplement that almost everybody will need.
And there's a rainbow worksheet in the back
Yeah.
that's absolutely vibrant and beautiful that gives really good ideas on filling up your rainbow in your diet. So thank you all for joining. We really appreciate y'all being here. Also wanted to thank Soup and Salad Shop for catering the soup today. And special thank you to Thrive Umpqua UC Veg for coming out. And also to YMCA for their support. Thank you both for being here. Really appreciate it.
Thank you.
Woo, thanks for coming. Good luck with that.